Alrighty. Thanks everybody for being here. It's really a pleasure to start working with you for the first time. Probably will be short and we'll try to keep it on time as much as I can. I don't have that many slides. It's mostly as Daniela was describing a little bit of an intro about what EEG is like and why we do care about EEG. So probably not to bore you too much. It's going to be quick and hopefully insightful. All right. Now, do I have to tell you guys next slide? Okay, great. Okay, perfect. So this is the usual slide I start with. I think I don't have to describe to this crowd too much why we do think about brain is involved in some of the reasoning behind an underlying mechanism with respect to genetic conditions. We know that that's true for global developmental delays and more broadly for neurodevelopmental disorders. And so the work that, again, similar to what Daniela just did, it's not just my work, it's the work of many people I have the pleasure to work with and mentor. And so really what we're trying to do here, next slide, is to really try to understand if it's possible to derive EEG biomarkers from, again, measures of brain function, trying to understand whether there's any correlates between these different brain biomarkers and then some phenotypical presentations. So in other words, really trying to understand whether the brain can tell us a little bit about how children and more young adults and adults in general behave and how that can tell them more about the trajectory of development. Next animation. So what or this place we're here really try to think about the current phase, which is collecting, sufficient pilot data in sufficiently big sample sizes, recognizing that we are working with fairly small sample sizes overall, and then more broadly trying to replicate some of the findings. This is the more short-term goal. Next slide is to then hopefully be able to use these biomarkers in small to medium and then hopefully large clinical trial studies. Next slide. All right, so getting to the nitty gritty of what looks like, I thank many families. 5 yesterday already went through, working with me and, upstairs from 4, 5, 6 on collecting some EEGs. And we're gonna, if you do a few clicks, probably 2 or 3, this is what it looks like. So there's no glue, there's really nothing like the more clinical EEG. We're working with this like very soft caps, which a lot of tiny sponges. And again, if anyone from yesterday did this and wants to share, that would be so great. Seamless experience. Oh, can you go back? Okay, great. And so, long story short, we put this on the child's head for about 15 minutes, very well tolerated, nothing really to worry about. And at the end of the day, what it looks like on the screen is a bunch of squiggly lines. We're not going to go over the class I teach for a semester long, what that means and all of that. But, trust me, the next slide, we're trying to move this from these squiggly lines to something like that, not necessarily, again, what it looks on the screen, but try to understand what the different frequencies in the EEG looks like. So trying to decompose the brain into different frequency, different aspects, which can tell us about, again, relationship between brain and behavior, and more broadly think about, again, long-term trajectories of development. Next slide. Alrighty, so this, I know it's a lot, it's overwhelming, but on top of working with you guys, which is great, we also do have a lot of other collaborations with, on the right-hand side of the slide, there's a lot of other family groups and foundation that we've been working with in the past, and then we're also lucky and really happy to be funded by many different sources in the US. So we really do not approach this in isolation. It's more the work, again, not just mine, but of many. And more broadly, it is to contextualize the results, not just within your group, any other specific group, but more broadly, really trying to get a better understanding of the brain and behavior in, again, in larger contexts. Next slide. All right, yeah, I think we can do a few clicks up to like the end of this. Here are just some stats or some numbers with respect to what we have achieved in the past 3 years or so, just to, again, stress the fact that it's not just me, most importantly is a team, but also many other families who have trusted us collaborating with them. So we've been having more than 300 participating families, a lot of different conference and family meetings around the world, which is great to get to know a lot of you and other families as well. We have a lot of participants and a lot of data collected, and also the important point, I think, it's we're also starting to enter in an exciting phase where we can actually look at this data, publish, and also disseminate the findings, which is very important also for moving the science forward in preparation, for example, for clinical trials or other endeavors in that space. Next slide. Alrighty, so I think you can do 2 more clicks. What we are trying to do here, there's many other things that we can do, but for the purpose of trying to keep it short and sweet for you families, but also for the kiddos and more broadly to trying to get something meaningful out of it. So I grayed out the middle. This is something we're not proposing to do here, but what we're going to be again doing up in 456, room 546 is we have a first part of this, of this data collection, which is rest in state. About 5 minutes, kids watch a cartoon. We have 1 hour ourselves, or whatever your kids would like best. And then the auditory evoke potential. This is just 10 more minutes. Kids listen to some sounds, and they just get to chill and hang out while listening to sounds. So again, no, don't feel pressure if we don't get to the sounds part. Resting is totally fine. We'll try to do that. And again, yesterday was pretty successful overall, so I'm really happy we got a head start on that. Next slide. Alrighty, yeah, that's good. So I always put this slide because I think it's important to recognize all the work you guys are doing in your kids. And so you guys own your data. This is, conversation we've been having with your leadership as well, by the nature of the fact that we have been discussing, this is more the first point, we've been discussing what made the most sense to do here and, how to move this forward. And then also we work with you to make sure the data that are collected here belongs not to me, but belongs to you guys in the sense that I have legal responsibility to make sure that the data is securely stored and used in the proper way. But this is your data, so anyone who would like to collaborate further with you as a foundation and use this data is more than welcome, and we can arrange everything to be able to share this. Next slide. Yeah, you can go up to the end. Okay, great. So I am aiming for 2 more minutes, so I think I'm on time pretty much. So we were able to demonstrate, successful, reliable collection of EEG data. And again, I'm really looking forward to see everyone who signed up for the EEG data collection. Again, very excited. I think we're going to get, a reasonable amount of data collected in the next couple of days. We have the unique opportunity collecting this data not in traditional clinical settings, but more in situations like this, to be able to derive biomarker representative of your population. So I think that's very exciting. And then more broadly, and I think this is going to be more the topic of tomorrow, really try to think about other works that have been doing both in, at Columbia, but also, these family meetings to be able to build multidisciplinary collaboration, which is key to be able to move the needle forward. Alrighty, next slide. I think it's a couple more clicks. So again, thanks to you for listening to this quick talk, for doing all the work, and especially kiddos trying to be our champions. And then here's my email if you need to reach out for anything. And then see those of you who sign up for EEGs in room 456. Thanks so much. And I don't know if you want to have questions or anything, I'm here.